Hello everyone, we are going to be talking about anxiolytics. The team members for this group project are Kimberly Ratcliffe, McKenzie Emery, and Karen Ketto. What are anxiolytics? They are a drug class obtaining the ability to relieve anxiety, usually by altering the hormone levels of the CNS or the central nervous system. There are three types: benzodiazepines, selective serotonin reuptake inhibitors, and non-benzodiazepines. Barbiturates were once the drug of choice. However, since they have been known to produce extreme adverse effects, benzodiazepines are the current drug of choice. First, we are going to be talking about benzodiazepines. The prototype drug for benzodiazepines is lorazepam, or also known as Ativan. The pharmacokinetics of this drug are the onset 1 to 5 minutes IV, 15 to 30 minutes IM, or 30 minutes PO. The peak, 90 minutes for IM, 2 hours for PO, and the duration of this medication is 12 to 24 hours. The pharmacodynamics are that it depresses the CNS, the central nervous system, by potentiating the GABA, which is a neurotransmitter. The reason for this use is anxiety disorders, preoperative sedation, and can be used for insomnia or panic disorders. The safe dosage is 2 to 3 milligrams PO per day, 2 times a day to 3 times a day for a normal adult, and 1 to 2 milligrams PO per day in divided doses for an older adult. Some of the major side effects include respiratory depression, drowsiness, and sedation. However, there are others which I have included in the graphic: headache, drowsiness, constipation, nausea, lack of coordination, decreased libido, heart rate decreases. The black box warnings are amnesia, weakness, disorientation, ataxia, sleep disturbances, blood pressure changes, blurred vision, and nausea and vomiting. Some of the nursing implications are: following parenteral administration, keep the patient supine for at least 8 hours and observe closely. For PO, take concentrated liquid solution with water, soda, pudding, or applesauce. For IM, administer deep into muscle mass at least 2 hours before surgery for optimum effect. For IV, dilute immediately before use with an equal amount of sterile water for injection, D5W or 0.9% NaCl. It is also a pregnancy category C. Special instructions for administration are: when administering IV, monitor respirations every 5 to 15 minutes, have airway and resuscitative equipment accessible. If overdose occurs, flumazenil, romazicon can reverse CNS depressant effects. Discharge instructions include: advise patient that lorazepam is usually prescribed for short-term use and does not cure underlying problems. If medication is less effective after a few weeks, check with healthcare professional and do not increase the dose. Educate patients on other methods to decrease anxiety, such as exercise and relaxation techniques. Avoid taking alcohol or other CNS depressants concurrently with this medication. Abrupt withdrawal may cause tremors, nausea and vomiting, abdominal pain, and muscle cramps.
We have selective serotonin reuptake inhibitors, or SSRIs. Escitalopram, or also known as Lexapro, has pharmacokinetics of an onset of 1 to 4 weeks, a peak of 5 hours, a duration that's variable. Pharmacodynamics include selectively inhibiting the reuptake of serotonin in the CNS and the antidepressant action. Reason for use is major depressive disorder or generalized anxiety disorder. It can also be used for panic disorder, obsessive-compulsive disorder, post-traumatic stress disorder, social anxiety disorder, or premenstrual dysphoric disorder. Its nursing implications include administering it as a single dose in the morning or evening without regard to meals, monitor mood changes and level of anxiety during therapy, assess for sexual dysfunction, and it is a pregnancy category C. Its safe dosage range includes for geriatric patients of 10 milligrams daily. For adults and children, it is 10 to 20 milligrams daily. Its major side effects include drowsiness and sedation. Black box warning, which means it increases risk of suicidal ideation and behavior in children, adolescents, and young adults with major depressive disorder and other psychiatric disorders. Special instructions for this administration includes assessing for suicidal tendency, especially during early therapy, assessing for serotonin syndrome. There is no specific treatment for overdose, so it needs to be treated by the symptoms as indicated. In cases of renal or hepatic impairment or in older adults, reduced doses are advised. Dose increments should be separated by at least 1 week. Its discharge instructions include advise patient and family and caregivers to look for suicidality or major changes in mood or behavior and to notify healthcare professional immediately if signs and symptoms increase. Instruct patient to read medication guide before starting and with each prescription refill in case any changes are included. If used during pregnancy, should be tapered during the 3rd trimester to avoid neonatal serotonin syndrome. After starting therapy, children, adolescents, and young adults should be seen by healthcare professional at least weekly for 4 weeks, every 3 weeks for the next 4 weeks, and on the advice of the healthcare provider thereafter.
Non-benzodiazepine. So first we have is zolpidem, also known as Ambien. So the pharmacokinetics for this is the onset is 7 to 27 minutes. It is rapidly absorbed following oral administration. Its peak is half an hour to 2.3 hours, and the duration is 6 to 8 hours. The pharmacodynamics, it produces a CNS depression by binding to GABA receptors. It has no analgesic properties and preserves stage 3 of sleep and has only minor effects on REM sleep. The reasons for use is for insomnia or difficulty in sleep initiation. The safe dosage range is 5 to 10 milligrams per day. Some of the major side effects is daytime sedation, confusion, amnesia, dizziness, depression with suicidal thoughts, nausea, and or vomiting. It can develop adverse neuropsychiatric reactions such as hallucinations, sensory distortion, sleepwalking, and nocturnal eating. A black box warning is that it is a Schedule IV controlled substance and that it can be abused and lead to physical and psychological dependency with severe withdrawal reactions. Your guys is right, is going to be Ambien side effects as well. Some of the nursing implications would be before administering, reduce external stimuli and provide comfort measures to increase effectiveness and medication. Protect patient from injury by raising bed rails, assisting with ambulation, and taking patient cigarettes. It is a pregnancy Category C drug. In addition, you should assess mental status, sleep patterns, and potential for abuse, as well as assessing alertness at time of the peak effect. Some special instructions for administration include, due to the rapid onset, to give immediately before bedtime. Also, it is not recommended for use longer than 7 to 10 days. Some discharge instructions would be to advise the patient to notify healthcare professionals immediately if signs of anaphylaxis, nausea, or vomiting occur. Also, educate the patient to avoid concurrent use of alcohol or other CNS depressants. You should also educate the patient that complex sleep-related behaviors may occur while sleeping. Do not take more than the amount prescribed because of the habit-forming potential. Tablets should be swallowed whole with a full glass of water and do not administer with or immediately after a meal. Also, do not crush, break, or chew tablets. Here we have some NCLEX questions for you. The first NCLEX question is, the nurse should assess a patient who is taking lorazepam for the development of which of these adverse effects? A. Tachypnea, B. Astigmatism, C. Ataxia, or D. Euphoria? Here is the answer. The answer is C. Ataxia. Adverse CNS effects for lorazepam include ataxia, amnesia, weakness, disorientation, blurred vision, nausea, and vomiting. The second NCLEX question that we have is, a 17-year-old patient has been prescribed escitalopram Lexapro for increasing anxiety uncontrolled by other treatment measures. Because of this patient's age, the nurse will ensure that the patient and parents are taught what important information. A. Cigarette smoking will counteract the effects of the drug. B. Signs of increasing depression or thoughts of suicide should be reported immediately. C. The drug causes dizziness and alternative schooling arrangements may be needed for the first 2 months of use. Or D. Anxiety and excitability may increase during the first 2 weeks of use, but then will have significant improvement. The answer is B. Signs of increasing depression or thoughts of suicide should be reported immediately. This drug carries a black box warning of increased risk of suicidal thinking and behavior in children, adolescents, and young adults.
Question. A student nurse notices a patient has an order for a benzodiazepine. If an overdose were to occur, what would the student nurse expect to give the patient as the antidote? A. Dilopholine, B. Ranitidine or Zantac, C. Flumazenil or Romazicon, D. Diphenhydramine or Benadryl. The answer is C. Flumazenil. Specific benzodiazepine receptor antagonists can be administered to reverse CNS depressant effects.
And these are our references. Thank you so much for watching.